Welcome to the Vitamin Professor podcast, brought to you by VRM Media, publisher of Vitamin Retailer and Nutrition Industry Executive magazines, in partnership with Nutraland USA. I'm your host, Gene Bruno, Professor Emeritus of Nutraceutical Science and Chief Scientific Officer at Nutraland USA. The purpose of this podcast is to help educate the dietary supplement industry about the science of nutraceuticals and other relevant topics. If you like what you hear and see, don't forget to like and subscribe. Let me tell you now a little bit about our guests today. Dr. Juan Hancke is an outstanding field researcher and scientific investigator who has an intense passion for pharmacognosy, the branch of knowledge principally concerned with the study of drugs derived from plants and other natural sources. Dr. Hancke has published over 80 scientific papers and has an astounding 20 patents. Since 1980, he's been investigating medicinal plants, beginning with 4 years at the Swedish Herbal Institute in Sweden, where he studied immunomodulating properties of Andrographis paniculata, also known as ParActin, the particular extract that HP Ingredients has. And he has collaborated closely with universities and research centers all over the world, including the USA, Germany, Great Britain, India, Italy, and Chile. He spends his spare time as full professor of pharmacognosy at Universidad Austral de Chile. Dr. Hancke studied veterinary medicine at the University Austral de Chile and was a postdoctoral fellow at Max Planck Institute for Biophysical Chemistry in Germany. Today, Dr. Hancke and I are going to discuss a branded extract of Andrographis paniculata, which I just mentioned, ParActin. Welcome, Juan.
Thank you. How are you?
I'm doing very well. I'm excited to talk to you today. I am, as I was telling you before we began the podcast, I am familiar with this particular material. In fact, I've actually formulated with this in some different products, used it personally, and actually even written a couple articles about it. So I'm pretty excited to talk to you, who are kind of the master of ParActin. What I'd like to do is I'd like to start out by just giving our audience, I'd like you to give a little bit of background about Andrographis, if you would.
Okay. Andrographis paniculata is a medicinal plant that grows widely in Southeast Asia, principally also in China and India. And so you have Andrographis paniculata in the Ayurvedic system of medicine, which is more than 2,000 years old. Yeah. And also on the other side, on the Chinese traditional medicine. So you have the most oldest system of medicine, Andrographis paniculata is there, right? And if you take a look now to the Western world, there is also particularly in England, there was already the structure of Andrographis paniculata was described in 1911 in the very reputed good journal Nature, right? So right. The chemical structure was already known back in the 1900s, right? Yeah. And then in the Ministry of Agriculture in England was categorizing this as a food ingredient, as a food bitter flavoring agent. And this was back in 1981. And another interesting point is that the World Health Organization has edited a monograph on traditional medicines, where Andrographis paniculata is now, a monograph of where you can read all what is scientific literature about Andrographis.
Yeah, you mentioned about it as a bitter agent, and actually I know it's also referred to as the king of bitters because it is so bitter. And yeah, interesting thing about that. So a few years ago, my son came to me and he goes, I'm having indigestion, having some
Yes.
gastroesophageal reflux. Well, I knew that as an old naturopathic concept of, hey, if you can get a little bitter taste on the tongue, that bitter taste can send a message down the vagal nerve, and it can help to the esophageal sphincter can help it to close up, thereby reducing that. And I said, well, if we could find something bitter, and it hit me. I went, wait a minute, I have some ParActin here. So I opened up a capsule and I said, okay, just do this and put your finger there. Don't take a lot, just put it there and kind of rub it on your tongue. He's like, oh my God, it's so bitter. I said, yeah, it is.
Yeah,
But don't you know,
bitter.
but don't you know that within like a minute, boom, his indigestion stopped because the bitter
Yes, in
taste did its
India,
job.
it is part of many remedies for indigestion, and liver problems.
And what's funny is, of course, it's not predominantly marketed that way in the U.S., but it's actually quite good for that purpose. But
Yeah, it is.
yeah. Now,
Yeah.
speaking of what it's popular for, it wouldn't be unusual to say that most people are using it, or a lot of people are using it for some anti-inflammatory or analgesic properties. But anti-inflammatory agents, they're pretty popular in the dietary supplement industry. The thing about inflammation is it's a pretty highly orchestrated process. There's a complex regulatory network of cells and mediators. And one of those mediators, nuclear factor kappa beta, has a relationship to andrographis. Can you tell us a little bit about that?
Yeah, sure. Well, NF-kappa B is a transcription factor, that plays a very crucial factor in regulating the immune response, cell proliferation, and survival. And it has been involved in many diseases, including cancer, rheumatoid arthritis, inflammatory bowel disease, multiple sclerosis, including even Alzheimer's, just to mention a few, right? And the interesting part was back in the beginning, I think in 2002, we were one of the first group, together with a group of the University in New York, that we discovered the mechanism of action, so to say, related to NF-kappa B. And this was done in neutrophilic cells. And at the same time, a group of Chinese, they discovered the same mechanism of action, in another type of cell. So it was quite exciting, to be able to be one of the first groups of scientists, that we were able to discover, the mechanism of action related to NF-kappa B.
Indeed.
So, yeah.
So and then I would. What I think it's kind of a simplistic way to describe it, but NF-kappa B kind of helps to adjust genes that produce inflammation, so it has a relationship there, and as such, could be quite an interesting means to help address inflammation, which I think is one of the reasons it seems to work so well for pain and inflammation. I mean, it does other things too, it affects COX-2 enzymes.
But because once, you get the activation, so to say, of the NF-kappa B, you get the pro-inflammatory, cytokines getting activated. And so there is a lot of cytokines released into the plasma that, flare up, inflammation. And that's what happens in many autoimmune diseases that we will speak on later.
Excellent.
But nowadays, I would say that the effect of andrographolide and related compounds, it's a multi-target drug, I would say. It has many, not only NF-kappa B, but is addressing also other pathways in the cells, that is becoming more and more complex. But in the end results, is to lower down all these pro-inflammatory cytokines and genes related to inflammation.
Awesome. So speaking of the andrographolites and endographis, can you address what effect they have on cartilage, which leads us into another discussion?
Yes, I mean, if we speak about cartilage, we have to speak about the health, so to say, of the cartilage, which has to do with the certain enzymes, which are called metalloproteinase, which is a family of enzymes that degrade the extracellular matrix compounds, and they play a very crucial role in tissue remodulation, so to say, inflammation and also disease. And when they are increased, you have the cartilage erosion. And there are many, many studies nowadays that indicates that andrographolite is able to reduce significantly different types of metalloproteinase and nitric oxide in order to reduce inflammation. And also we were pioneered back in 1911, where we published the first study on the effect of an extract of andrographis on rheumatoid arthritis.
Yes, yes, yes. I wanted you to talk about that too. What about you? There's human research on ParActin for rheumatic disease. I find that fascinating. Can you just tell us a little bit about that?
You see, because once you establish the mechanism of action, then you can, so to say, elaborate certain ideas of where ParActin or andrographis could be of help. And one of the areas was autoimmune diseases, right? Autoimmune diseases, you have multiple sclerosis, rheumatoid arthritis, and so on. And so we did our first study in rheumatoid arthritis, and we had very good results, because we were able to reduce the number of, I have it here, tender joints,
Right.
the total grades of tender joints, also the rheumatoid factor, which is increased in this patient. And so that prompted us to do research with different types of rheumatoid arthritis. And we did it on rheumatoid spondylitis, on rheumatoid arthritis vasculitis, on psoriatic arthritis, all the types of rheumatoid arthritis, also in the erythroderma, serositis, and in all the cases, we were able to find similar results as a reduction, of the C-reactive protein and, and many symptomatological reduction of these factors.
And one of the things I liked about that one is when I looked at some of the research myself, I was also pleased to see that the dose wasn't so amazingly high that it's difficult to do. It was only like 300 milligrams a day total of the ParActin. And sometimes you look at some of the materials that are effective out there. I mean, certainly turmeric can be effective if you use the right one with the right delivery system and all of that. But oftentimes it can be some pretty significant doses that you have to use. A gram or more a day. This was 300 milligrams as an efficacious dose, which, I'm not saying that you can't use curcumin. Certainly it has great potential and could even be combined with something like ParActin. I was just impressed that 300 milligrams was an efficacious dose. As somebody who formulates a lot of products, I appreciate that because it's easy enough to, if you're giving it twice a day, 150 milligrams twice a day.
That you mentioned there, because andrographolite, it's a small molecule, it's 350 something. And so it crosses the brain barrier. So it's very easy, to be absorbed. And we have been able to give ParActin on a daily base for 3, 4, 5 years and make the follow-up in different patients with different types of rheumatoid arthritis. And we didn't found side effects except some minor stomach ailments or some skin rash. But on the whole, the product is very well tolerated, and you can give them on a chronic regimen.
Well, I'm going to give you a little testimonial here because I personally have psoriatic arthritis, and I have found that the use of ParActin was tremendous for me. It was one of the very few nutraceuticals that I found that was very experiential, had quite a significant impact for me personally, helping to reduce pain and inflammation. It was great. So I'm a big proponent of it on a personal basis, and professionally I am because of the research that I've seen. I think it's a pretty wonderful material.
Yeah, it is. Now we are in the middle of completing a study on osteoarthritis, which is the next step, so to say.
Yeah.
And when you have already, erosion of the cartilage, and we did a 1-year trial on knee osteoarthritis, and the results are very promising, and they seem to be able to change the course of the disease, and this is quite good news. And
oh, indeed,
yeah.
Especially when you consider that the whole population of individuals that have osteoarthritis is so much larger than, say, rheumatoid or psoriatic. It's so much larger. So you can address that. That's going to help a whole heck of a lot of people. But in addition,
nowadays,
yeah. So I think that's great. I'm looking forward to hearing the results of some of that research, because I think that's something worth letting everybody know about when we get the results from that.
Yes, this is interesting because in osteoarthritis, all the trials that exist on nutraceuticals or even common drugs, they address a period of treatment not more than maximum 4 months at the most.
Right.
And none of them is able to modify or hold the progression of the disease. What does it mean? That the erosion of the cartilage goes on and on, And in our case, we were able to see that the progression of the disease comes to a halt. And this is something, that we're working now and evaluating the data in order to send it during the next 6 months for publication.
Excellent. So within, let's say between 6 months to a year, I can look forward to seeing some data out there that I can review on the effects on that. Maybe I'll write a little something on that when I see it. That's pretty cool. Now, and of course, as an anti-inflammatory agent, joint disease isn't the only areas it can help. When you think about an area like muscle recovery, for people who are, athletes or working out in the gym, that's another area where it has potential effectiveness. Could you talk to us a little bit about ParActin with regard to muscle recovery?
Sure. When you work at the university, you get a lot of questions. One of my colleagues that works in muscular dystrophy, he said, Juan, could we test your product in our model of muscular disease? Yes, of course. And we were very surprised to see that in a muscular disease, dystrophia of Duchenne, the pure compound andrografolide was able to stop the fibrotic tissue, right? And so we were extremely enthusiastic. And so we published some work on that, and we follow it up with some clinical studies in Duchenne, which is a genetic disease of muscular dystrophy. And the results, on the whole, were very positive. And to sum up, I would say that due to his anti-inflammatory effect, it could potentially, andrographis alleviate muscle inflammation and oxidative stress also. Thereby, it helps to aid the recovery of muscles and potentially also enhance muscular performance. So this is something that we have observed in our trials.
You know, in reviewing some of the research on that, I saw that, you know, you had certainly reduced muscle damage, but you had lower serum levels of creatine kinase. And we see a lot in research that's been done on athletes where you have breakdown of muscle, you have this increase in creatine kinase. And so when you see a lowered creatine kinase, I think that kind of bodes well for an effect here that can help with muscle pain. Because, you know, in the gym, they say, well, you know, no pain, no gain. But sometimes, you know, you can get a little too much of that pain. And so if there's something that can be done to help it, I think this has some pretty interesting potential there. So
correct, you know, because we did prove, you know, that andrographolite was able to regenerate the muscle. You know, this was something that we were able to see in the lab, and also the deposit of fibrotic tissue, which is when you got a bruise or when you got, you know, a strength of the muscle, you know, a strain. This is something that is happening, and andrographis ParActin is able to revert the situation significantly.
indeed. So, okay, we talked a lot about ParActin's anti-inflammatory effects. And we even briefly touched on things like it's the effect of bitters on digestive health. But ParActin and andrographis in general also has some effects for immune health. Now, I know that there's some research on the common cold. Can you sort of address that overall area of immune health and maybe some of the research on ParActin and the common cold?
Sure. Well, as I mentioned, in the Western world, andrographis became very well known in Sweden. The whole story started there, where Kanyang became one of the most popular products for the treatment of common cold back in the 80s, right?
Right.
And our group was the first to publish a study on common cold, and then from then on, you know, many other groups, you know, have been publishing a study on common cold and viral upper respiratory tract infections. And that's how the story on the use of andrographis for immunity started, and also not only for the treatment, but also for prevention of common cold.
Yeah, prevention, and at a lower dose too, I know.
At the lower dose, and that was the very interesting discovery, because a fellow of us discovered this in Wisconsin University, and we were puzzled because we saw that on a very limited range, the andrographolite was able to increase interferon gamma and interleukin-2 and T cells. So we said, oh, this is interesting, because after you increase the dose, you go into the anti-inflammatory effect. So there is a very small window of effect where you can see that andrographis, you know, has this immunostimulant effect, right? And well, this is what is going on in immunity, you know, and this has been also being used in the industry for animal production, and so that's what we are investigating presently.
You know, so thank you for that. And I wanted just to revisit for a moment. As a formulator, one of the things that I always appreciate is if you can find something that has some efficacy at a low dose, you can then include it with another formula. So immune formulas, especially since COVID, have been very popular. And I know in that one 3-month study, it was randomized, double-blind, placebo-controlled, and everything. that the ParActin, they were looking at like 25 milligrams a day. It wasn't a high dose. And compared to placebo, there was like a pretty significant decrease in the incidence of common cold. So for somebody's formulating a product out there and they want to do something for immune health and they want just something as a preventive measure, you can put in 25 milligrams of this. Yes, the 300 milligrams is fantastic and that works really well for inflammation, but as low as 25 had a meaningful effect on reducing, the risk of the common cold. And I think that was pretty cool. Of course, if you had the cold and you took ParActin, it actually helped that quite a bit, helps you to recover more quickly and and all of that, and get greater symptom relief, really statistically significant results. But what excites me is not just that, hey, it's good if you have the cold, you can take it, but at a low dose, 25 milligrams, you can actually get some really meaningful results. So I would encourage people to consider the use of it in a formula for immune health at only 25 milligrams. You can afford to do that,
Absolutely, and we did this study on prevention with very low doses, prevention of common cold, and we were able to see that the group that received the 25 milligrams, so to say, of andrographis was able to reduce 2.1 events less common cold than the group of the placebo.
Yeah, wow.
So, and this is published data, so it's you can check that. And so, yes, I think certain products, not all medicinal plants have this dual effect, like completely contrary. It's like the yin and yang,
Yeah.
It's a new concept in pharmacology where you have with high doses, you elicit certain effect, and with lower doses, you elicit the contrary. So this is something that is coming up with certain plants,
So with regard to andrographis,
Okay.
we were talking about immune health. But, one of the things that we always think about in immune health is ever since the pandemic, COVID-19 comes up in a lot of discussions. And there's actually been some research on andrographis with regard to the SARS-CoV virus in COVID. Can you discuss a little bit about what is known on that potential application?
Sure. And I will go immediately to the clinical data because there is a lot of there is a lot of
in vitro stuff. Yeah.
Sometimes it might help but sometimes it doesn't work in the clinical studies.
Sure.
And there was a publication done by the same group where I used to work in Sweden, where they took a group of 140 patients and they divided it in two groups. I think one was 68 and the other 72. And they were giving for 14 days andrographolide. I think the pure compound was around 90 milligrams per day. And what they measured was the rates of cases turning into severe, right?
Mm-hmm.
And the detection of corona over the period of time during this 14 days, the duration of the disease, and the severity of the symptoms. And the results were that only 5% of the group giving andrographis turned into severe. But in the placebo group, almost 20% went into.
That's huge.
Yes.
Yeah, that's a big difference.
So, of course, here we are talking about moderate to mild cases. We are not talking about the difficult cases. No, it's not the case. So, in summary, you have a lesser duration of the disease, the number, so to say, of sick days, is less. Right. and the severity of the symptoms was also decreased, like sore throat, runny nose, things like that, right? So yes, and I think that independently of the SARS-CoV-2 variant infection, the Andrographis paniculata, yes, it has been proved, not proven, but it has the potential, to be used in the mild and moderate cases of COVID-2.
Well, look, I think that anybody who's been unfortunate enough to contract COVID or any of its variants knows it's not a pleasant situation. However, if your case is more mild and less severe, that is certainly highly desirable.
No doubt,
And
no doubt.
and if you can say, here's something I can do that may help promote a good immune response and may help reduce the likelihood of going from a mild or moderate to a more severe form and all of the discomfort that goes along with that. I think it's well worth considering. And in the study that you're citing, I'm aware of the fact that it was found to be safe, effective. There were no severe adverse events. And so, I think that it makes a good deal of sense to consider that. You
Absolutely,
can,
and it has a lot of antiviral effect, not only for the common anti-respiratory virus, but also for SARS, Epstein, and so on, mosquito, and so on. So I think it's an antiviral. The antiviral properties are there. Right?
well, in fact,
Yeah.
I think I'm correct in stating that back in 1919 in India, when there was a influenza epidemic, they actually used a andrographis tincture, and that was effective in helping to arrest the epidemic spread. So there is a precedence here. There's a history of use of this, even in relatively modern times, showing effectiveness. Besides the more recent data, there's older data demonstrating that as well.
Yes, we are now, this is a second study we are completing now on common cold in India again.
Nice.
In the middle of the study, and yes, it's the effect is always there, and it's amazing.
It is amazing. So we've covered some pretty good areas on here. We've talked about, again, digestive. We've talked about the anti-inflammatory effects. We've talked about some of the immune effects. So my question is there anything else about andrographis, about ParActin, that we haven't covered that you think bears mentioning, or do you feel like we've pretty much covered it all?
Well, I think perhaps it's interesting to mention Alzheimer. And
Ah,
I mentioned this because we did several studies, and unfortunately we have not done a clinical study, but considering that the amyloid that deposit in the brain forms these inflammatory sections around the deposit of the beta amyloid, there you have nowadays, an immense amount of information where state that andrographolide in the models of Alzheimer it has a strong effect. So I think this is an area that probably will pop up more and more in the future.
well, I think that's going to be a fascinating area of research, especially as you consider the aging population, not just in this country, but in other countries.
Yeah.
The prevalence of Alzheimer's and other kinds of dementia are increasing. And so anything that can be beneficial for that, and you could start to think about, some of the people who are older, who are more likely to be candidates for Alzheimer's, these are the same people that are having joint issues and so forth, and maybe their immune response isn't what it could be. So, being able to have a single nutraceutical that has potential for helping in all of these different areas, it's pretty cool. So,
Yeah, it is.
Yeah. So listen, I love the information you presented. Thank you so much for joining us and sharing this information with us, because I think it's so important. Again, as on a personal basis, I've used ParActin. It's been very good for me. In fact, I got to call Annie over there, see if I get some more. And uh, and also, as a formulator, I just think that it has many applications well worth considering. And when a brand is looking for something that really works, that they can put in a product that consumers are going to feel and then keep coming back, ParActin certainly comes to mind. Um, I'd like to thank Dr. Juan Hancke
Thank you, Jim
for
Bruno.
joining us. Thank you so much. And for those of you who are listening, if you liked what you heard and saw today, please don't forget to like and subscribe. We'll see you next time on The Vitamin Professor.